Hello learners, today we are going to discuss regarding one of the trending medical topic nowadays, that is monkeypox virus. And here in this video we are going to discuss regarding all the must known facts regarding it, mainly regarding the host and reservoir and regarding the incubation period, regarding the course of the disease and how we have to diagnose the condition. So let's dive deep into the topic. So first, it is a viral zoonotic condition. So we all know it is a viral infection, and what this zoonotic is indicating. Zoo is indicating animal. So here this disease mainly originates from the animal and it spreads to the human or gets transmitted to the human. That's why it is called a zoonotic condition. And here this zoonotic condition is very similar to a dreadful disease that was smallpox, which was almost eradicated in 1980s itself. And this condition is very much similar, but the most important thing that it is clinically less severe than the smallpox virus. And both of this monkeypox and smallpox virus belongs to the same family, that is orthopox virus. And this monkeypox virus is a double-stranded DNA virus. And here in case of monkeypox, based upon the origin, there were two subtypes. One belongs to West African, another one belongs to Central African, that is mainly Congo Basin. So this disease was more frequently seen in African countries, and this disease was an endemic in African countries. So now let's move on to the next must know fact regarding the monkeypox virus, that is what is about its previous outbreaks. So there was a lot of previous outbreaks. Let's see. First, it was identified in 1970 in Congo, and there it was seen in 9-month-old baby. And here is some correlation with smallpox. In case of Congo region, this smallpox was announced eradicated even in 1968 itself. And then after that, around 11 African countries had shown the endemic outbreak of monkeypox. And around 2003, this disease was observed in USA, and after that there were a lot of outbreaks outside the endemic countries, and more frequent outbreaks had been seen after May 2022 in non-endemic countries. Even in India, recently we had counted 4 cases of monkeypox virus. So this is all regarding the previous outbreaks of monkeypox. So now let's see the next fact regarding it. What about its host and reservoir? So before discussing regarding the host and reservoir of monkeypox virus, we should know the exact difference between this host and reservoir. Many people used to get confused that these both are synonymous. No, it is not synonymous. They are little bit different from each other. What is this host? Host is nothing but where the organism is getting originated, or source of the organism. Our reservoir is nothing but the place where the organism gets multiplied. So this is the exact difference. So in case of monkeypox virus, already we know that the disease gets originated from animal. So here the host were different types of squirrels, tree squirrels, then rope squirrels, non-human squirrels, and then Gambian pouched rats, then dormice, and more researches were still now conducted to identify the host and reservoir exactly. So let's see what's next. How it is getting transmitted. So this is one of the important question because till now we are not over of our corona pandemic. It got transmitted all over the world. As I had already told, the disease gets transmitted first from animals to humans. So here how it is getting transmitted. So mainly by the direct contact with bodily discharges of infected animals, blood, bodily discharges, bodily fluids we can say, any cutaneous or mucous lesions. Because of the direct contact with it, the disease will get transmitted into human beings. Now comes the next question. After getting transmitted to humans, again there will be human to human transmission which is happening with corona. And here it is because of the close contact with the person, with the affected person, mainly with the respiratory infections like fluids from the respiratory tract or droplet infection we can say, and direct contact with the skin lesion fluids and recently contaminated objects that may act as a transmitter. So this is how the virus gets transmitted human to human. And here the most important question you might be asking, whether the disease will get transmitted from mother to fetus. The answer is yes. It gets transmitted via placenta, and even there is chances of getting transmitted before and after birth, as it will spread easily through the droplet infections. So there are more chances of fetus getting affected. So be cautious, and we have to make aware regarding this disease to all the pregnant mothers. So let's see what's next. Regarding the incubation period of the disease. Before knowing regarding the incubation period of monkeypox, we should know what is incubation period. So the time between the exposure to infection to the development of first sign and symptom of the disease. So let me explain the other way. So here is an already infected person like this, and here one healthy person. So there is a close contact, and this close contact is leading to the exposure of healthy person to the infected person, and this virus will go inside and it will take some time to develop this first sign and symptom of the disease. So this period is exactly called as the incubation period. So in case of monkeypox virus, it will range from 16 to 30 days, and sometimes it may range from 5 to 21 days also. And knowing incubation period is much more important, because if we are knowing that, we can think about doing quarantine. So quarantine is nothing but separating the healthy person who had got contact with the infected person for the longest incubation period. So here for example, the longest incubation period is 13. So if any healthy person getting contacted with the infected person, we can make the person quarantine themselves for 13 to 15 days to prevent the spread of infection. So let's see what's next. How it will appear in human body. It is nothing but the course of the disease. So here we have two periods. One is invasive period and another one is skin manifestations. So what happened here, in case of invasive period, it ranges from 0 to 5 days, and here the patient will be developing fever, myalgia, asthenia, that is weakness, and myalgia is nothing but bodily pain or muscular pain. And there will be intense headache. And there comes the most important distinctive feature of monkeypox, that is lymphadenopathy, which is seen in prodromal stage itself, that is very early stage of the disease itself we will be seeing this lymphadenopathy. So that is the differentiating feature. And now regarding the skin manifestations, how the skin rash will appear. So here, first the skin rash will appear more frequently in face of the patient. Around 95% percentage of affected patient develop the skin rash in the face. And then second position goes to extremities, mainly in case of palms and soles. Then sometimes the third frequent location is oral mucous membrane. And then in case of genitalia, and at last in case of conjunctiva or eye. And still now we had seen the frequency of appearance. So let's see the morphology exactly. First, the lesion will be appearing macule. Macule is nothing but the lesion will be pertaining only to the skin level. There will be no raising. So like this pattern. And then it will change into papule. Here there will be little raise above the skin level. The eruption will be like this, and this papule gets changed into vesicles. So here what happens, this raised elevated portion will be having clear fluids. So that is why it is vesicle, and this vesicle gets changed into pustules. So here what happened, all the clear fluids will be getting changed into pus, or pus formation appears now. And then it is followed by bursting out and crusting formation, like yellow or brown crust will be appearing over the surface, and finally it will dry and fall off. This is the exact morphology what we can see clinically. So here what happens, first is invasive period, it ranges from 0 to 5 days, and here we will be having fever, myalgia, asthenia, that is weakness, then intense headache. At last there will be lymphadenopathy, which is the distinctive feature of monkeypox infection. And then comes the skin manifestation. Here the skin eruption is more frequently seen in face and extremities, and the morphology will be from macule to papule, then papule to vesicle, and then to pustule, and at last into the crest. Okay, so this is regarding the course of monkeypox virus infection. So let's see the next. So what it will lead to if complicated. So here we have to discuss when it will be getting complicated and what it will lead to. So now let us discuss regarding our first question, when it will get complicated. First of all, this is a self-limiting condition, and it may range from 2 to 4 weeks. And here the major risk of complication is seen in people who are having immune deficiency states, as we had seen in COVID infections also. Immune deficiency states, people were at high risk, and here also same thing. And here we can see children getting more affected and young person. So there is some important finding regarding this particular age group getting more risk towards the condition, that the researchers were explaining those people who had not been vaccinated for smallpox have the chance of developing the disease. In the other way, we can say if we are getting vaccinated from smallpox, we can be resistant towards the infection. So what happened, because of eradication of smallpox, this vaccine had been stopped, and the young person who are around 40 to 50 years had not been vaccinated, so there are more possibility of young person to develop the disease condition. So this was the interesting explanation given by the medical researchers from WHO. So now let's see the exact complications what it will lead to. So already it is a viral infection and it will lead to secondary bacterial infections. Then it may lead to bronchopneumonia. Then it may lead to sepsis. Then it may lead to encephalitis also. So these are all the complications we can expect in case of monkeypox virus. So here we should know regarding this case fatality rate of monkeypox. It is nothing but the killing power of the disease, nothing but like we can say if the virulent power is more, the killing power of the disease is more. So here the monkeypox CFR ranges from 3 to 6%. So let's see what next. So the most important thing, that is how to diagnose this monkeypox. So here in case of diagnosis, we have two things to discuss. One is clinical diagnosis and laboratory diagnosis. So clinically, we have other differential diagnosis where we can see fever with skin rash. Those were chicken pox, measles. Based upon the appearance of lesion, we have to go with the diagnosis and lot of other investigation regarding the course and symptomatology. Then scabies we can think. Then in case of syphilis, the skin lesions which may mimic to this similar condition, and then any medicine related allergies will lead to this type of similar pattern. So first of all, we have to make a differential diagnosis from all these conditions, and here the most interesting and important phenomena you have to remember is lymphadenopathy. So here what happens in case of monkeypox, this lymphadenopathy will develop even in the early stage or prodromal stage, which will be uncommon in case of this condition where there will be fever with skin rash, that is chickenpox and measles. So with the help of this lymphadenopathy, we can get a clue regarding the monkeypox viral infection. And now moving on to the laboratory investigation. Still now, polymerase chain reaction test is considered to be accurate and sensitive. And here the samples will be mainly taken from the cutaneous lesions. And in case of feasibility, if there is any like feasibility of doing, then we can think about going for biopsy. So these were the laboratory investigations till now recommended by WHO. So this is all regarding the must know facts. We had discussed up to diagnosis, and in next video we will be discussing regarding the treatment, prevention and vaccination. And if you have any doubt regarding monkeypox virus, just comment below. We will discuss regarding that too in the next video. Thank you so much and happy learning with us.